Hello, everyone, and welcome back to the Social Work Bubble podcast. I'm your host, Laura, and I practice as a therapist in New York City. I have my bachelor's and master's degree in social work and currently work in private practice. Today, we're going to talk about the things I've noticed since leaving community mental health in October and what really needs to change if we want to see social workers and therapists staying in community programs. So I think to start, one of the most obvious things is the lower pay and higher caseloads. Obviously, being in private practice, you can essentially set the rate that you want. You can charge basically however much you want. Now, I am not at my own private practice. I'm just an LMSW in New York State, and I think all states, you can't have your own practice until you're an LCSW. With there being lower pay and higher caseloads, what I mean by that is when you practice as a therapist, you're typically in a role of that of fee-for-service. So basically, you get paid if a person shows up for a session. You do not get paid if someone does not show up. Something that is an issue in community mental health is clients have a lot going on in their life. We're going to touch on this later on, but they might be involved in many different other services or programs. If they're at a community mental health program, they might be from a low income background. They might have housing issues. They might have substance use concerns. So there's a lot of reasons other than just typical mental health difficulties that make it hard to show up for appointments. So that being said, there's an inconsistency in attendance and engagement in community programs. So often in my experience, I would have to overload my schedule, by which I mean I had like 60 hours a week I would be working, but it wasn't a guarantee that that person would be showing up, or if they didn't and I would reschedule for later in the week, it was very, very difficult. Now, of course, we can say, well, that's on you. You have to have boundaries, which is true to an extent, but I also have to pay my bills. I have to pay my rent. I have to eat food. And, I live in New York, so it is more expensive. But no matter what, it's also difficult when you're fee for service because there is that inflexibility with pay. It's unstable, and there are some days, even like this week in private practice, it's a holiday week. We have Thanksgiving coming up. A lot of clients have canceled, and so even though I technically only have Thanksgiving Day off, I don't have a lot of other sessions going on this week because other people are already out of town on vacation. So we just have to keep those things in mind. We often overload our schedule to buffer for no call, no show, and cancellations. And that also makes it very difficult to take time off because it's not like paid time off. It's not any of that. It's time off at your own expense. And so, if you're not working, that means you're not getting paid. And it's very difficult to even take extensive time off in that way. Number two, it's very difficult to meet clients where they're at because of agency policy. So in some ways, community mental health has policies that are not strict enough. And then in other ways, programs have policies that are too strict and not flexible for clients' needs. And I think something that we forget is the people that we work with, like I said earlier, are in many other different programs. They have many other different needs. Also with that, people's own mental health. If people have depression, anxiety, PTSD, schizophrenia, any of these other diagnoses that we see a lot of in community mental health, it's going to be difficult for them to show up anyways. And so something I found was my agency, I didn't know this at first. I didn't know there was a discharge policy, so I would give too much flexibility to my clients, and I'd be a little too, okay with them just like not showing up. And I think that I do attribute that. I have to take responsibility for that, but a big part of that was I was also burned out. So if they needed to like take a couple weeks, I was like, okay, that's fine because I have other things to do. But it's hard because I remember one client in particular, I've talked about this before, where she was not showing up at all. ever. And looking back now, she had attachment issues. She had very, very hard time with depression. She had a hard time forming relationships with other people because of her trauma. And so for the first few months of therapy, she barely showed up. She was hardly even there. And other therapists that she had worked with, she told me she'd been with like 4 other therapists who had discharged her after she missed 2 sessions, which 2 sessions is a lot. Later on, I learned that the agency I worked at had a 3 missed session policy, which I think is pretty reasonable. I'm more on like the 4th session, like if you miss a month, like that's kind of extensive, unless it's like an absolute emergency or something. Which, if that happens 4 weeks in a row, that's kind of crazy, and I don't know. So it does make it hard to really meet clients where they're at in some sense because of agency policy, especially ones that are so strict, like missing 2 sessions in a row. That seems a little crazy, especially when we expect these individuals that need a lot of support to just manage all of these things all at once. Like if you actually sit down with a client and go through their week and look at every single appointment they have to go to, every single phone call, trying to manage their own benefits and navigate these different systems that they're in on their own, it is just insane. Like it really is a full-time job plus some, because a lot of them are also parents, or they're also in school, they're also working full-time anyways, and so it becomes very difficult. So I think we often discharge a lot of clients that, if we gave them another opportunity, would fully engage in therapy, or if we really had a conversation with them, like, what's going on? Like, how can I support you now so you stay receiving these services? Sometimes I think that we just feel like we don't have time for those conversations because of our overwhelm, because of the burnout that we have, and oftentimes because of agency policy. Number 3 is overwhelmed supervisors. My supervisor ran the entire clinic. So we were part of a nonprofit that had multiple different sites. So like multiple clinics throughout the city. My supervisors that I've had were each overwhelmed in their own ways. There was often times when our supervision would have to be cut short, or we'd have to reschedule, and then it might not even happen for that week. So I think a lot of the times, even when I was able to consistently have supervision, I was still working independently. And I think in some ways, if you're looking for a job and you notice that they're really valuing independent workers, I understand why that's important. And I think for a lot of my life, being independent has been something I've done, usually because of a trauma response and like perfectionism and all of these different things that go into play. And it was kind of praised because of the environment that we're working in. So because it's stressful, because everyone has such a high caseload, supervisors have to oversee everything, they have to run a clinic, that they have their own administrative meetings. It's a lot for them to deal with. They don't want to have to also walk you through your job, holding your hand, which is also different than just giving a regular amount of support. Like I felt I really couldn't go to my supervisor spur of the moment and just be like, I really got to talk to you about this case and this client, or this really concerning thing came up. A lot of the times I felt like I was on my own trying to figure those things out, which has been really interesting in working in a private practice now, where it's a relatively smallish practice, but my supervisor is so supportive, where it's really difficult for me to know when it's appropriate for me to go to my supervisor for a question or for approval on something. And so sometimes, like, I took a client and we had agreed to bi-weekly sessions, which in my previous place of work would have been like a fine. But in this practice, they wanted to like review to make sure the client's needs were being met, like the reason for bi-weekly session, like it was more involved to make sure everything was going well. And it literally didn't even cross my mind. And I realized it's because I've really been trained to work independently, but perhaps to a fault, where I'm not seeking out supervision. I'm not seeking out support from the people around me, whether that's my coworkers or my supervisor, because I've just been like trained into thinking that that's not important, or that they're not going to have time for me, or that I should just like figure it out, which is a very dangerous space to be in, because we want to be providing the most helpful and effective supports to our clients. Number 4, this kind of concern with community mental health is interesting, and particularly if it's a nonprofit organization. They're often relying on government funding, donations, things like that. And because of that, the office space, or the space that you're working in, is often dependent on that funding and, what's affordable. With that being said, New York also has a very different cost of, what office spaces are going to be. But I was lucky enough to work at one of their new clinics, so it was very nice, it was very fresh. But I visited a couple of the other ones, and they were a little downtrodden, if that's the word. They were a little dingy. And the first time I went there, like, my first impression was, I don't know if I'd feel comfortable coming here for therapy. Like, it kind of seemed like a stressful environment. There was no really color in the walls. It just seemed a little dingy. And to me, I'm thinking, this is supposed to be such a safe and warm and welcoming space for the people that we support, that desperately need a safe haven. And my first feeling was that was not any of those things. So I think that was interesting, was because our space is, and the environment that we work in, is not only important for the social workers' mental health, but for the people that we support. We can only create so much of an emotional safe space when the environment is the opposite of that. So it's just something to be mindful of, because there's no cost difference in the color that you paint the walls. There's no cost difference in, like, it's not going to run you to the ground if you like buy a plant or get some warm lighting. Put some lamps up instead of the fluorescent light, like put a blanket and some pillows around, like those small things that are not that expensive, even if you just go to the dollar store or something, just to make the environment more comfortable, can be so, so important. Light a candle, like these small things that you do in your own home, bring it to these spaces to just make it at least a little bit more comfortable. Now, obviously, this is very different because I'm in a private practice now. Before, when I was working in the clinic, I had my own office, which was quite large compared to the other offices. I didn't have a window, so that was a huge bummer. I was not a fan of that. And because I spent such long days in the office, there in the winter time, I would go into work when it was dark out, and I would leave work when it was dark out. And that was very, very hard on my mental health. But the way that the office was, they also gave me this massive desk. So the best setup was I had to have this desk in the middle of the room. So then there was a desk in between me and the client during therapy sessions, which is like therapy 101. Don't have any physical barriers between you and your client, because that can create emotional and mental barriers to the treatment you're trying to provide. And so that was kind of frustrating. Now to private practice, it's like I get my own comfortable, it's like an office you would see in a movie or in a show that depicts the therapy session. There's like a full-on comfortable couch, there's lamps, there's a cute rug. I get my own cool therapist chair and a little side table. It's just like paintings on the wall. It's so comfortable. And there's also a massive window, which has been amazing. So it just really shows the environment. And also, I feel more comfortable. I feel less clinical. I feel more, I don't know, just the space really sets the tone for the sessions that we have. Number 5, something else. This is more just something I noticed that also does need to change, because it kind of goes into discrimination and systemic racism, is the difference I'm seeing in demographics. Now, something to know is the private practice I'm working at is based in Manhattan. The community mental health clinic was based in Brooklyn. So already the neighborhoods I was working in are going to be different. So the demographics are going to be pulling different populations. When I was working in Brooklyn, primarily I'd be working with Black and brown families. I did work with a few white clients, but a lot of them also overlapped with child welfare, with substance use, and with like other family needs. So maybe I was working with parents, their children were also receiving mental health treatment. Maybe they were having concerns at school and was referred by the school social worker for outpatient treatment. And it was, to me, just very, very apparent, because these families were also way more involved in other social service systems. So whether that was court involvement, whether that was in IEPs, whether that was assistance in some way, benefits, SSI, what's the food one? I can't remember. TANF, SNAP, that's what I meant. All these other benefits. Maybe they were homeless, in shelters, and it just really showed the difference in demographics, because the clients that I worked with in the community mental health clinic were also significantly more policed. Right? So when you're involved in all these different systems, you have more eyes on you. And it makes it incredibly, incredibly difficult to be allowed to be human, to be allowed to make mistakes. Whereas in private practice, now working with majority white clients that are financially well off, financially stable to an extent, or at least generally better off than the clients I was working with in Brooklyn, we don't really refer to other services unless that's necessary. Like we might refer to like a group therapy, but it just seems very different. Like I just feel it was just a testament to discrimination and systemic racism that is often seen in social work, in that many of these families, you could see the generational impact of poverty, of mental health that went untreated because they weren't given adequate supports, of police brutality and generational trauma from racism and discrimination, which contributed to generational mental health concerns. And it was very difficult to see, also because I knew the supports were there, but people's ability to access them, or maybe they had other things coming up in their life. There was just so many things to manage, which also, it just added to the stress of their lives tremendously. Like, how can I offer support to this Black mother that has a child with autism, he has a hard time with some of these meltdowns that he's been experiencing, when the one time that they called the mobile crisis team for child mental health support, the whole entire, the police showed up, fully armed, ready to shoot down the house. In that way, it was also so much more difficult to effectively offer the support that was supposed to be there for them, when they were they were doing what they need. They called the mental health crisis line. It was very difficult, and I don't think it's a coincidence that that is what was happening for Black and brown families, and that's not what's happening for the white families and people that I work with now. And I'm not saying that to say it was a testament to systematic racism, basically. I'll leave it at that. Point number 6 is something that we need to change about community mental health is the turnover. Something that was very difficult, which was very difficult in me leaving community mental health, was I knew that the turnover was high. And because of that, I had more guilt with leaving. I had more guilt with having to talk to my clients and let them know, hey, another person in your life is leaving you. Another professional, another therapist, another social worker is out the door. It was very, very difficult for many of my clients, and I expressed that I saw that before they could even say it, especially with ones that I've known have had difficulty keeping a therapist for reasons outside of their control. Because it's community mental health, because of the overwhelm and the burnout and the stress of the programs, it's not just about the workers and how that's affecting the workers, although that should be important and a priority because we matter, but also because it directly impacts our clients. Like, if we truly want to work ethically and effectively and best support the communities that we're working with, we have to give social workers great workplaces, places where self-care isn't just chatted about, but boundaries are actively put in place. The burnout and turnover rates are lower because, as we're seeing, staff just keeps coming in and coming out and all this and all that. And many agencies, community agencies, are used as like, okay, let me get this 1 year of experience so I can go work at a private practice, which is honestly what I ended up doing, and no long-term relationships. So it's just reinforcing this idea that the people that can only afford community mental health, people with a lower income, people that maybe are involved in other services like child welfare, substance use, family therapy, court involvement, shelters, experiencing homelessness or housing issues, they're also not getting consistent long-term support. Then they're having to reestablish their own relationships with professionals who has to relearn what they're experiencing again. And by the time they get comfortable, that person is probably out the door too. And it's frustrating to see. And I was put in that position where I had to ask myself, what's important here? Like, financially, I can't do this anymore. Commute-wise, I can't do this anymore. Like, this job is draining me, and I truly love the people that I work with, and I want to see them flourish, and I've seen so much progress from them. But I had to put myself first, and it was such a hard decision to come to because I was just going to be another social worker that left them. And that honestly sucked. But it's one of those things where we do have to take care of ourselves and work on changing the system that promotes that kind of relationship where people think, okay, overwork. You have to work with as many people as you can, increase your caseload even more to best help the community. But that's not it. That is not it. If we want to look at long-term solutions, we need to be changing the system and the policies. We need to be providing better pay for social workers. We need to be putting benefits and vacation time and paid time off and sick leave and all this stuff that's like actually generous and humane into what people can do, including for fee-for-service work, which is often not given benefits. It is important, not just because we should be treated as humans and we should be working in good environments, but because it also directly impacts the clients that we work with. Because then we leave, and then things are up in the air all over again. Attachment issues are brought up again. It could be traumatizing for a client, honestly. And it's just making these issues worse for the people that we work with. As you can see, and I'm very annoyed by this because I didn't want to feed into the system, but I also had to take care of myself. And I think that's what makes it hard. And I think what's also frustrating is I think so many directors, program supervisors, they're all just like, I don't understand. All of these therapists are leaving. All of these social workers are leaving. It's pretty simple. Like, it's pretty simple. If you see a pattern, there's a reason there's a pattern. This is an obvious issue in social work that is often talked about. It is not a surprise, but it should not be normalized. We should not be able to work in an environment where we're killing ourselves to do a job half well when we're not even helping our clients effectively at that capacity. So, off that tangent, my last note is something I've talked about before. It's pretty simple and straightforward. We've all talked about the insane amount of paperwork that social workers have to complete. A lot of this does overlap with community mental health, which I understand. Sometimes that's not up to the agency because the Office of Mental Health, who does audits, they're the ones that often control what documentation is needed and to what extent. And let me tell you, it's insane. It's literally insane. When I say it's just, I would probably spend, depending on the day, I would have an hour to 2 hours of paperwork every single day. That's outside of my therapy sessions, which were back to back for 10 hours every day. And it's just like, where's the time? Like, where do you have the time? And that's just paperwork, like doing an intake assessment, doing a safety assessment and safety plan, doing progress notes, doing treatment plans, and other notes as we need them. We had to document every single contact we had with a client. Like, if I texted them a reminder, I had to note that. It was just crazy. It was crazy. I had to document every single email I got from another provider regarding a particular client. It was so much. And that paperwork is not including the 10 million referrals I had to do for clients. SSI, SNAP, TANF, they were constantly requesting like these 20-page assessments and thorough documentation and explanation of how I came to this conclusion, how this client's mental health is affecting their ability to work and all this stuff. And I'm just like, who has the time? I do not have the time to do this. I don't have the time. And it was driving me crazy. Now I'm in a private practice where even at a full day of therapy sessions, it takes me 15 minutes to do all of my notes for that day. 15 minutes, that's it. Like, that's just crazy. It truly is crazy. So, I'm sure that doesn't even like touch the surface of things that need to change in community mental health. I truly did love the time that I worked in the clinic, but it really did just ruin my mental health. It really did. And I don't want to feed into a system that just actively doesn't support its workers and in turn doesn't support the communities that they say that they do, because it's just trash. But change does need to be made, and these programs are so important to really supporting communities. I think it's great to support nonprofits. I myself want to start a nonprofit in a couple of years, and I really do find a lot of joy in being able to support the people around us. But we can't do that in an unhealthy work environment, and we can't do that when we're burnt out and lost our motivation and drive for doing the work, because social work is so awesome. It is so awesome if we allow it to be, you know, if we actually have boundaries and give ourselves time to enjoy it, then it can be wonderful. But we're not going to enjoy it if we're in environments like this. So change needs to be made. You know, if that has inspired you at all, see what can be changed in the agency that you work at. Look at the policies that are in place. Use your own voice. You know, speak to administration about what they can do to really change and offer support to you guys, because you can leave. You can leave. And so it's important to use your voice and to see if change can be made, if they're willing to make that change and keep social workers there long term. So thank you all so much for listening. If you have any comments or want to share your experience in the social work field, mental health field, please comment or share on whatever platform you're listening on. You can follow me at Social Work Bub on Instagram, Twitter, Facebook, and Pinterest. You can check out the Social Work Bubble Etsy shop, where I provide worksheets and activities for social workers, therapists, others in the field, and my website, thesocialworkbubble.com. I hope you're all staying safe, and I look forward to continuing growing together in the wonderful field of social work.